All right, YouTube, it's Clear Vision Wednesday, and I'm Claudia Mühlenweg, your favorite, or maybe not your favorite, vision improvement expert. And I'm here today with a special guest that I cannot be more excited about. And her name is Dr. Sharon Stills. And I'm just going to read a little bit from her bio, and then she can maybe share more about her. But our topic is hormones and eyesight, and how that is connected. And you might not even know. And I honestly don't know about myself. I don't think my hormones have affected my eyesight, but maybe they did. We will find out today. So Dr. Sharon Stills is a naturopathic medical doctor who helps perimenopausal and menopausal women to pause and evaluate life so that they can live the second act of their story stronger, healthier, and sexier. I love that part, while aging backwards. Using her 20 plus years of experience and extensive training and background in European biological medicine, anti-aging therapies, and bioidentical hormone replacement, she has successfully helped thousands of women transition gently through the different stages of their lives with all natural methods. And the last bit I want to share, you are an expert physician for the Women's Health Network, and you educate other physicians as the co-lead North American lecturer for the Paracelsus Academy in Switzerland. So welcome. Let me highlight your video so everybody can see you. Welcome, Sharon.
Happy to be here. It's great to see you, and happy everyone's on, and we're going to have some fun today and learn some things.
They're very, very cool. So maybe share a little bit more about yourself, like how you got into all this stuff, and then we will switch to like the hormones and how that connects to vision. I'm always curious about our own stories, right?
Sure. Okay. So I'll try, and I could spend 3 hours talking about that. I basically, and we all have, a lot of us have that wounded healer. So we get into this because we're seeking our own answers, just like those of you that are watching are seeking answers that you're not getting from your typical doctor's office. And so I grew up very unhealthy, very sick, in and out. I was so sick with asthma and allergies. I couldn't even walk outside if the grass was being cut, or I couldn't breathe. And I was so sick and at the doctor's office so often that the pediatrician said he wanted to put a plaque with my name over one of the exam rooms and name it after me because I was there so much. And it's nice to have a room named after you, but not necessarily a doctor's room where you're sick. And so and then from there, I was overweight, depressed, asthma, allergies, headaches, hormonal issues up the wazoo, just so sick. And I was living a typical life, eating at McDonald's and going to the ice cream store for dessert. And my parents, God bless them, but they didn't know any better. So they would just do what the doctor said and pile on the antibiotics and the allergy shots and all of these things. And so no one was looking at my root cause issues. And then the depression led to significant addiction with alcohol, with drugs, with cocaine. So I was just a walking disaster. And I ended up married early and pregnant right after I got married. I was like 20 years old. And when you get pregnant, it's one of those things I was just talking about the other day with someone, where people who have lung cancer, all of a sudden they're able to quit smoking. And so pregnancy is like that. It just kind of wakes you up. And I got concerned. I didn't want my son to struggle like I had struggled. And so I happened to be living next door to someone who was a good friend at the time and was really into natural health. Her brother was a colon hydrotherapist. And so they just started introducing me to colon cleansing and nutrition. And it just made so much sense to me. Like, oh my goodness, imagine that. What you eat actually affects you. And my baby at the time, my eldest son now, who also is a naturopathic physician now, he had really bad eczema and really bad ear infections. And I learned not to give him dairy products. And so it just began this whole journey for me of natural healing. And I was just obsessed with it. And this is back in 1989. This is a long time ago. He's 32 now. And so there was no internet. And so I have these like memories of myself sitting on the floor of Wegmans which was like the Whole Foods of where I was living upstate New York in Buffalo at the time. And just sitting there in front of like one little tiny shelf that had natural things, trying to figure out what could I feed him, what could I do. And there was a book by Dr. Mendelsohn about natural pediatrics. So it wasn't a lot of information, but I was just trying to get it any way I could. I went across the border. I visited a naturopathic doctor in Canada, and I just thought, this is amazing. There's this whole world of how to get healthy out there. And at the same time, I was also getting divorced. I was 23 or 24. I had 2 children under the age of 3. By then I had had my other son. And I thought, I want to do this. I want to help other mothers because it's not so easy to figure this out. And I've spent all this time and energy figuring out. So I'm going to go to naturopathic school, and I'm going to do what that doctor in Canada does. And I'm going to help mothers with their children. So I initially went to school to become a pediatrician. And so when I went through school, that was really my focus, was pediatrics and also psychiatrics. I had a brother who committed suicide. So that was also something on my heart that I wanted to learn more about. And then I opened up my doors of my clinic in 2002, so almost 20 years ago. And everything changed. My 7th patient was a cancer patient, and that started my career in oncology and naturopathic oncology and bioregulatory medicine and studying over Europe. And then another very early patient came into me holding Suzanne Summers' book and wanted to know about bioidentical hormones. And I was like, I always have this belief the universe only sends you what you can handle. One of my professors had said that in medical school, and I owned that and thought that's true. So I told her, well, I don't really know much. I didn't know that Chrissy from Three's Company is now writing about hormones. But let me read the book because I have an open mind. And I read the book and I thought, wow, this is really cool. And with my naturopathic training, I can really add some other dimensions to this. So I said, sure, I'll do this for you. And I did it for her and changed her life. And she told her friends who told their friends. And before I knew it, I had this giant clinic of women going through menopause who wanted bioidentical hormone replacement. And so I soon became an expert in it. So I was in my early 30s at the time. I'm 53 now, and I am postmenopausal. So I was young helping all these women, but it really gave me this trail, this way of looking at it. So when I went through my own transition, it was easy. And that was not how my hormones had been. My hormones had been horrific. I had PMS 3 weeks out of the month, and then I would bleed, and then I would have a couple of days feeling good, and then it would just start all over again. I would get so bloated that people would ask me when the baby was due, which is like a very embarrassing thing when someone thinks you're pregnant and you're not, but you're just so bloated because your hormones are so out of whack. And so I struggled really bad. And because this patient brought me this book and I started learning about hormones, I, of course, Physician Heal Thyself, I started working on my own hormones. And so when I went through menopause, I never even had a hot flash, which is really unheard of. And I had such a beautiful experience, and I love being in menopause. I think of it as the sacred second act, because I believe we have 3 acts of our lives. And I'm really passionate about helping other women get balanced and embrace their journey and their power and their wisdom and live a fulfilling life.
Wow, I had no idea some of your background. That's just, you went really through the worst. And here's one thing that stood out to me is that that neighbor, right, who gave you, talked about that, because so many times we might feel like we're preaching to the choir, we're talking about these things and people are getting annoyed. But I realize, that one thing that you say to somebody can change somebody's whole life trajectory. And that's why I'm so passionate about educating, because I feel like you might hear this one thing from somebody. I always talk about the seeds, right? A dandelion, you blow the seeds in the wind, and then some of them, find fertile ground and others don't. And so, yeah, I wish I would have known you a lot earlier, because I've been I went to menopause 10 years ago, and I've had hot flashes and still have hot flashes. So we need to talk. But let's talk about eyesight. Let's talk about eyesight because this is our topic today. And so I've had a student, or actually more than one student, talk to me about, well, I noticed when I went to menopause or when they started with bioidentical hormones, that wasn't with you, that was with other doctors, my vision got blurry. And how could that be connected? And I was like you, I'm like, well, let me find out because I don't know. I love how you said the woman gave you the book and, how we kind of like, oh, interesting. Let me find out. So I'm like, let me find out who can solve this or can answer this question. And that's why I invited you here, because I think this is an important topic that nobody talks about, and certainly not the eye doctor. So can you just share a little bit of light on the whole connection of hormones? And I know hormones is not just sex hormones. That's what everybody thinks, but okay, go ahead.
So yes, so estrogen, progesterone too, but really estrogen has a lot of impact on the eyes. And so can blurry vision be an issue? Now, yes, when estrogen levels decrease, your vision can get blurry. So when you say that she went on hormones and her vision got blurry, it made me think that she wasn't placed on the right form of hormones or the right dose. And so I do a lot of educating, which I'd like to talk about a little briefly here for the women listening, because that's kind of a mission of mine, is for women to really understand and make sure they're getting treated the right way and monitored the right way. And there's some really simple things I can share that you can just make sure you're doing. And so estrogen levels, as you're going through perimenopause, which is the time before you go through menopause. So hormones are this roller coaster, and they're always fluctuating. They're always doing a dance, and they are in concert with each other. And so when we are before menopause, and this could be 1 year, this could be 10 years, everyone is different. But so if you're having eye issues and you're in your early 40s, you might not even think about, oh, I should have my hormones checked. And if you go to the gynecologist or your primary, they're not going to think about having your hormones checked either, because typically you're just told about your hormones when you're going through menopause and you can't sleep because you're hot flashing so bad. But hormones are something we should always be thinking about. And so the estrogen levels are going to naturally decrease. That is what menopause. So pause is the cessation of your monthly cycle. And that happens because your hormone levels drop. I think of menopause, and I write it with a parentheses around the pause, because I think it's this beautiful time in your life to stop and look with your vision, but your internal vision, your external vision, at what is happening in your life. Where have you been? Where are you? And where do you want to go? Because it's these moments of change that gives us an opportunity to harness and empower ourselves to be the driver of our lives. And so we need to pause and look not only at our health, but at our activities and our relationships and our journeys and our dreams. And so this is all happening while the hormones, so the balancing of the hormones to me is the easy part, but the digging inside and looking at your vision and looking at your life, that's where we really need to dig in and do the work. And so when the estrogen levels are decreasing, yes, it stiffens the cornea. It affects how the light is refracted through the eyes. I see a lot of dry eyes, and I'll tell you a story about that in a second. So don't let me forget about my dry eye story.
Can I say one more thing that I love
Sure.
about what you said about the pause, because this is exactly what I'm talking about, how it's more than eyesight, right? It's your vision, how you see yourself, how you like where you want to be, like what are the next 20, 30 years. A lot of people just think of retirement and then it's like, and then what, right? So like I just love how you connect that also with your menopause bracket pause. So I think that's just, I just wanted to say that. So dry eyes, yes, okay, I will remind you, because that is a big topic, especially now. It's even worse with COVID and screens.
And it's definitely, estrogen is what gives the cornea its elasticity. So that has a role in how the light is traveling through the eye and can lead to dryness. And so it's just when you lose estrogen, we get dry. our joints, the lubrication goes away. So a lot of times when you're going through menopause, you'll have joint pain, you'll have painful intercourse because your vaginal tissue is drying up and your eyes will get dry. And it's really a simple fix with hormones. But for someone who you mentioned who went on hormones and it made her vision blurry, to me, that's an extreme sign of, oh, she wasn't given the right dose. So let me tell you my dry eyes story, and then I'll talk about some proper tips for hormones. So I had a patient who came to me early on and she had dry eyes. And so I also always think from a traditional Chinese medicine perspective, from an Ayurvedic perspective. And so when someone has dry eyes, I automatically think of the liver because the liver energy opens up into the eyes, and the liver is intimately involved with hormones. So someone who was given estrogen but wasn't told to focus on their liver detox, that could have been a problem why the estrogen was causing too many issues and causing the blurry eyes because they weren't detoxing out. So everything is connected. Everything, you can't just do one thing in the body. And that's why I love how you talk, Claudia, about the eyes and it being related to the nervous system. And it's so, because I was guilty of that. We've been taught we have eyes for the eye doctor, we have teeth for the dentist. We've been taught to section out our body and not think of our eyes as an expression of the whole body. And the truth is, it's all important. It all plays a huge role. And so dry eyes can be a sign of estrogen issues, but it can also be a sign of liver disease. And I had this patient early on in my practice, in my career, who came in with dry eyes. And yes, we're looking at hormone balance, but I started looking at her liver health. And because of her dry eyes, I was able to diagnose a rare autoimmune disease affecting her liver and her gallbladder because I looked at the eyes and I know that the liver opens up into the eyes. And so we want to be thinking about our liver. We want to be thinking about our hormones. They're all connected into each other. And so when you're doing hormones, some of the things you need to be thinking about is you only want to do bioidentical hormones. So if anyone offers you synthetic hormones, you can just say, thank you, but no thank you, and go find another doctor, practitioner, office to work with. Synthetic hormones, synthetic estrogens are made from horse urine, pregnant horse urine at that. And so they contain forms of estrogen that our bodies are not even familiar with, that we don't even produce in our bodies. Even non-pregnant horses don't produce some of these estrogens. So even the synthetic estrogens aren't good for regular horses. They only come from pregnant horses. And so it's really important that you're working with bioidentical, which means identical to your biology, that these hormones are what your body normally produces. And so that's what your body can understand rather than these foreign molecules that it doesn't know how to accept. You want to be working with natural bioidentical compounded hormones, and you want to make sure that, like, when you're reading things online, that you don't get confused, because most of what you read online or most of what you hear, like you talked about how I heard something from my neighbor and it changed the course. And in this day and age, it's great. We are in information overload, but you can also be led down the wrong path. And whether it be from a Facebook post or standing online at the market or what your neighbor says when you're at a family dinner. And so you have to be careful of where you get your information. And even my patients of many years, sometimes they'll even call and say, are you sure this is okay? Because I just read this. And I have to remind them, no, this is about synthetic hormones. You're taking bioidentical hormones. So we have to be conscious of what we're seeing and what we're taking in and not be led astray.
I love that. It's so easy to get on the wrong track nowadays. We have too much information. And anyway, I have two questions. So one of them, what are other symptoms of hormone imbalances? We talked about blurry vision, we talked about dry eyes. And my second question, I would love to know a little bit more about those bioidentical hormones. what are they made out of, and how do they, because I think that would be interesting for a lot of people. And how do you know, like, what are other symptoms? Yes, hot flashes and night sweats, but are there any other symptoms in your vision and in your body that indicate hormone imbalances? And I do want to say one more thing. It is kind of tricky that menopause or perimenopause often happens at that age, right? When it's like, oh, now we need the readers. And you said that the hormone levels, the dryness affects, the cornea too. But they always just make it sound like it's age related, right? Age is like the only reason. And I know some women that went into menopause in their 30s, and I know some that still had periods in their 60s, right? So it's like, but it's still like the 40s, you don't even think about hormones, right? When your vision gets blurry, it's just like, oh yeah, I'm at that age where I need readers.
Right.
So,
Well,
yeah.
that's like in everything we're taught. It's just age. Oh, you're going through menopause. Of course you're going to get fat. It's just natural. And that is so not true. Or, oh, you're getting older. Of course you're in pain. Of course you don't have energy. I was just talking about this the other day. I feel healthier personally at the age of 53 than I did at the age of 23, because I feel like I'm aging backwards. And because of the care I take of my body, because of all the knowledge I've accumulated and continue to learn, and I'm always tweaking and changing things, I feel so healthy. Then we're supposed to be at our best when we're growing up and a child. I was so sick. And so we have to really work to decompose those beliefs out of our brains and not allow them to guide us. We have to really believe that at any age, at any time, we can reinvent our health. And that is really true. And I was just with some patients and I was saying, I'm so mad at myself. I can't believe I haven't taken pictures, because you're literally aging backwards and you look healthier and more vibrant at 70 than you did when I first met you at 53. And so it really happens. And you just have to put in the work and change your lifestyle and do all those good things. So what, did I answer your question? What was the question?
No, but I think what you said was so interesting. And I think you're right about the pictures, because we do that when we are pregnant, right? I took pictures of the belly growing, getting bigger, but we don't really take much pictures of, like, in terms of like, how do we change and how the vibrancy. And I feel the same way. I'm 60 now, and I feel more vibrant when I look at some of those pictures back then. No, the two questions, like, what are other visual symptoms other than blur and dry eyes, if you know, for vision, or generally speaking, of hormone imbalances? And then what are bioidentical hormones, or what are they made of, or how, you talked about the horse urine and the synthetic ones, which technically could also be marketed as natural, right? It's like on food products, when they say natural, I learned that raspberry flavor is made from the anal glands of beavers, not even kidding. So it's natural, but it's not a raspberry.
But maybe we needed a little more definition on the natural, right?
That's what I'm curious, like, what's, because technically horse urine is natural, right? It's like, it's natural. So tell us about, like, any other symptoms, and also, like, what are bioidentical hormones and how do you get them and what are they made of? I'm just curious for anyone listening.
Other symptoms, I would say those are the big ones I see. There's also some thought that loss of estrogen can contribute to developing glaucoma. And then cataracts seem to develop in that age range, but I don't know if it's a definitive result of hormones. It might just be happening at the same time. I don't know that it's really from, but definitely the blurry vision, the dry eyes is probably the biggest thing I see. And as we all know, dry eyes can just ruin your day. It is not a comfortable thing. And we have to remember, I always think of symptoms as these beautiful messengers. So when we have a symptom, again, in society, we're taught to suppress the system, tell it to shut up and go away, and what pill can we take to get rid of it? But I teach my patients, and I live a life of listening to my body. So when you have a symptom such as dry eye, you could go and get some saline drops over the counter, but then you're not listening. Your body's trying to say, hey, there's something out of balance here, and now I'm having a symptom. So I love to reframe the way we look at symptoms and what we can do with them. They're actually sacred messengers that help us to know where we are out of balance and what we need to, and then sometimes we need to dig and figure out what it is we need to do to return to balance, but we know we're out of balance. And then, so bioidentical hormones are made in a compounding pharmacy. So that's not something you would get over the counter at Walgreens. I have special pharmacists that I work with who make them. They're plant-based and they come in different forms. But I will tell you that the only form I use for 20 years is a cream. So if anyone ever wants to give you bioidentical estrogen, and I don't know if this is what happened with your person who was having issues with her eyes, but oral estrogens lead to inflammation. They'll raise your C-reactive protein. They're very inflammatory in the body. So you should never take oral estrogen. The only hormone that I give orally would be progesterone in a sustained release capsule, because it crosses the blood-brain barrier in that form and it breaks down to allopregnenolone, which acts like GABA, and it has a very nice relaxing effect on the brain. And so it can help you with anxiety and sleeping and water retention and all sorts of things. So your hormones should come, I had a syringe here the other day, but it's gone off my desk. Your hormones should come in creams. They should be, so a lot of women, and Dr. John Lee, who first wrote that book, What Your Doctor Doesn't Tell You About Hormones, I think it was a long time ago, but he popularized progesterone, bioidentical progesterone. He changed a lot of lives because bioidentical progesterone can help with PMS, with endometriosis, with fibroids, with menopause, with sleep, with anxiety, with so many things. I always say that if I want to get flowers, I give a woman bioidentical progesterone, and then her husband is so happy he sends me flowers because I give him back his wife. And so you want them to be in a cream form. So I was talking about John Lee. So he kind of talked about, put the cream here on your wrists, or put it on your breast, or put it on your belly. And what we have found is when you do that, you get something called dermal fatigue, and the hormone starts to build up in the fat tissue. So I only have patients apply hormones to mucosal tissue. So down by your vagina, there's moist tissue. It's called your labia, the external labia. And that's where I have the hormones applied, because you get really good absorption and you get a steady state. And I always use hormones together. So no just giving estrogen. You have to give estrogen with progesterone, with testosterone, a little bit of DHEA, a little bit of pregnenolone. And DHEA and pregnenolone can be given sublingually. I use a liposomal form for good absorption. And you always have to be supporting the liver, because when you take these hormones, they need to be detoxed out of the body. They metabolize, and you need to know what type of metabolites are being created. So this is another thing that I see all the time, and it drives me crazy, is doctors measure hormones via blood work. And it's a very inaccurate way to measure hormones. So women are misled all the time because they're taking some hormones and then they have blood done and they're told, oh, your levels are too high, you have to cut your hormones down. And that's not always true. So I measure hormones in specific 24-hour urine testing from specific labs. And we're able to look at the metabolites, because estrogen is just a word. You don't get estrogen, you get forms of estrogen. So the most popular forms are E1, which is estrone, E2, which is estradiol, and E3, which is estriol. And so these different forms break down into different metabolites. Now, some of these metabolites are really protective. Some of these metabolites I actually compound and use to treat women with breast cancer. That's how protective they are. But some of them, not so protective. Some of them go in and affect the DNA in a negative way. Some of them cause inflammation. So you really need to see what's happening so it can be modulated. And so my opinion is bioidentical hormones are super safe as long as they are monitored and administered by someone who has my kind of training, who knows what they're doing. And I find even in the alternative health field, there's a lot of people who say they're doing bioidentical hormones, but the way they're doing them, the way they're monitoring them, I wouldn't send anyone to see them because they can end up in trouble. And that's not to badmouth anyone. That's just my personal experience. And what I see a lot of patients who come to me from that situation where they had pellets inserted into them, or they were taking creams, but they were taking them improperly, or they weren't monitored properly. So I think it's really important, just some of these basic things, if you're going to go out and look for bioidentical hormones, to have a consciousness and be aware of, so you can get good treatment and be monitored properly.
Yeah, thank you so much for breaking this down, because my doctor, my traditional, just regular doctor, OB-GYN, he just, they just gave me a 0.5 milligrams estriol, which, like you said, is just one of the 3 estrogens. And they don't look at the big picture. We never did a Dutch test. They never even did a blood test. And I have a lot of clients too that tell me, oh, I did a blood test. And you're right, we have to do the urine test, the Dutch test, right, in order to really know what's going on. And
actually, I don't use the Dutch test. I use
but I mean, the point of urine test.
I mean, the Dutch test is like the new kid on the block, but I've been doing this so long. So I do my testing through Meridian Valley, which is Jonathan Wright's lab. And Jonathan Wright is who I studied and learned from, because he's the father. He wrote like the first prescription for bioidentical hormones. So I always find who's doing the best, who's the head of it, and I go learn from them. And then you also asked a question I don't want to forget about symptoms. And so symptoms, we talked about eye symptoms. Obviously, there's hot flashes, but weight gain, insomnia, depression, anxiety, heart palpitations, loss of sex drive, loss of hair, urinary tract infections. I mean, pretty much everything. It expresses itself different ways. We have to worry about bone health. So someone could have osteoporosis. It could be showing up as digestive issues. So there's so many different things that hormones impact. And a lot of patients just think that hormones for menopause are just to get rid of hot flashes. So I said before that I never had a hot flash. There was one experience where I was like, is that a hot flash? But I don't think it really was. So I never really experienced that. And I know I have patients, and it could be devastating, and you can't sleep, and it's embarrassing, and you're sweating in the middle of, and so I know how damaging and it can be. But even without having suffered myself, because I was balancing my hormones all through perimenopause, I still take my hormones. And I don't know if you ever get asked, but I always get asked as a physician, if you were on a desert island and you could only take 3 things with you, what would it be? What are your most favorite health things? And my hormones, I always say, they're going in the coffin. I'm burying them with me, just in case. You never know what happens. If I wake up, I want to make sure I have my hormones with me. So, and I don't take them, like I said, for hot flashes. I didn't have any symptoms, but I take them because I want to have healthy bones. I want to have a healthy brain. I want to have a healthy sex life. I want to have a healthy cardiovascular system. So I want to have healthy eyes. There's so many reasons why, excuse me, why I take them that have nothing to do with symptoms. So again, as I said, sometimes I think it's good that we have some symptoms, because it then leads someone to say, oh, I think my hormones are out of balance. And then they get to really learn the benefit of using hormones as part of your healthy aging program.
And I love that you said, symptoms are beautiful messengers. I always call them the engine light. And ideally, we don't wait for that to happen, right? We do our oil change before the engine light comes on. And that's the same thing what you just talked about. So I love that you said it's really a great idea to just, don't wait for the bad stuff to show up. And yeah, I've had 10 years of hot flashes. So
no.
I'm definitely going to talk to you more in depth. There's one question that came up that I just want to and then we can end this, the live stream. It was like, what are the postmenopausal hormone requirements? My doctor never discusses this, and I have done no hormone therapy or no hormonal therapy. Like, what are the requirements? Like, is there a way to know, what is the ideal situation, or is that too complicated in biochemistry here?
So if you mean what should you be taking and what kind of doses, is that?
Yeah, kind of what the requirement, what is supposed, because like you said, if there's no engine light coming on, like, how do you know that you should do something if you don't have any hot flashes or no symptoms, no engine light? How do you know that it would be maybe a good idea to take bioidentical hormones?
So I would say if that's the case, depending upon where you are, if you're done and you're through menopause and how old you are, if someone came into me, then I would start them on low doses of Biest, which is mainly estriol, but has a little estradiol in it, progesterone, testosterone, a little DHEA, a little pregnenolone. And I would put them on it for about 6 to 8 weeks. And then I would run a urine test and see what they're doing with it and how their levels look. And then I would adjust for there. I also check for oxytocin, melatonin, aldosterone, growth hormone. And we didn't even talk about thyroid. And we know thyroid eye disease, if you're hyperthyroid, and if your thyroid is low functioning, it's related with age-related macular degeneration. There's changes to the retina. And so you can definitely have trouble seeing as well if your thyroid's not balanced. And that's a whole also has to be measured properly, has to be taken properly. We have rampant autoimmune thyroid disease, and most doctors don't even check for that unless you're a holistic doctor in the field. And so we've been conditioned to get our thyroid checked by one level, a TSH in mainstream medicine. And it's not even what's coming out of the thyroid. That's just what the pituitary is telling the thyroid to do. So you really need to have a full panel of TSH, of free T3, of free T4, of reverse T3, of anti-TPO and thyroglobulin antibodies to really see the whole picture. You have to look at temperatures because lab work is great, but people are more important to me. I was talking to a patient yesterday who I'm treating for Epstein-Barr, and she said, I feel better now than I have in these last 2 months. I feel better than I felt like the last 7 years. And she said, so I know you hope my blood work looks good too. And I said, well, yes, but that's not the most important thing. The most important thing is how you feel. And then the lab work hopefully confirms it. But I'd rather have a patient feeling great because lab work is lab work. It's, there's different ranges, and what's good for you may not be good for me. So I always look at optimal ranges and just ranges in general in lab work, because ranges are set looking at healthy populations and define a healthy population.
Oh my God, don't get me started on the whole ranges of lab work, because what they consider normal is not, it's not good. It's not optimal, right? Okay, there's two more things. First, there's one last question that I think is worthwhile asking. And then I want to find out, or have you share, how can people work with you if you work remotely, if you have programs? So the question is, what do you do with women who had a hysterectomy? And I think that's a really good question, because that's another thing that, is very common.
I am actually, I don't even know if I can say this, but I'm actually in the middle of a big project focusing just on women who have had hysterectomies in a telemedicine platform. So, but women who have had hysterectomies are definite candidates for bioidentical hormone replacement. So they might need a little higher dose. Again, it just depends where I'm catching them, how symptomatic they are. There are some women, typically a woman has hysterectomy, and I see this a lot because I work with a lot of oncology patients. So a lot of women are thrown right into menopause from having cancer, or having uterus and ovaries removed, or if they've gone through chemo treatments. And so typically it's harsh. The symptoms are bad, but sometimes I see women, they don't even notice it. And so we also have to remember we are producing estrogen in our fat tissue. And so depending if we're overweight, we might have a little more estrogen going on. Not that I'm saying we should be overweight. And then we also have to remember that our adrenals are supposed to take over production and be the secondary ovary, if you may, and help us. And that's a whole nother topic, because most people's adrenals are shot because we live in a stressful world, and we don't sleep enough, and we don't see the sun enough, and we don't dance enough, and we don't relax and we don't breathe and we don't eat and all of these things. And so, as I said in the beginning, it's this giant symphony. You wouldn't want to go to the symphony and just hear the percussion. You want to hear the horns and the wind instruments and the strings. And that's what makes a symphony so beautiful. And it's the same in the body, addressing all of the endocrine hormones so that you can have a beautiful symphony, your health.
That was just, there's nothing to add. That was so beautiful. So how can, last thing, we put a gift that you give everybody in the description, but how can people work with you? Get the gift and then you get in your email list. But I'm just curious, do you work with people remotely? Do you work in groups, or do you see?
I do work remotely. So that was something so many people work remotely now in the age of COVID. But I was a forefronter. I've been working remotely for 10 years. So I closed my clinic that was on the East Coast 10 years ago and went remote back then. So I am very adept at working remotely. So I work with people all over the country, the world, and get really good results because a lot of this can be easily handled. The testing that I'm talking about, you do in the comfort of your own home. And so it's very easy to help women no matter where they are. I also have women who will fly out if they want to be scanned on my thermography, if they want to come for a private retreat. So I do that also. But my main thing that I do is telemedicine. So if anyone is interested in that, they can call my lovely assistant, Samantha, at 602. Let's see if I know the number, 363-3143. We just got a new phone. So you can text her, call her there. And if you're interested in finding out about that. And then as far as groups, yes, I'm hoping to be doing an online menopause class because I love teaching and I love being in community. Before COVID, I was running a lot of retreats, women's health retreats. So I'm hoping to be able to get back into that soon when people are back to really traveling and being together. But I'm going to hopefully, after the new year, have an online menopause course where we just kind of go through all the important things of being healthy, because lifestyle is such a huge part of it, from proper sleep hygiene to proper hydration to exercise to meditation and all these other things that go along with that.
Wonderful. And everything that you just listed also affects your eyesight. So I'm definitely would love to be in your group. And I think it's a great idea to teach this in the group format because a lot of the information is the same. So thank you so much. We will be doing our little mini chat in my Clear Vision Club right after, but YouTube, we're going to go bye-bye now to YouTube. So thank you so much, Dr. Sharon, for all this valuable information. I learned definitely a ton. And it's like you said, the endocrine system is not just like, here's an estrogen pill, but this is kind of what our traditional doctors, right? They just do that. And anyway, thank you so much. This was incredibly helpful. And bye, YouTube. We would stop.